No, because
I accidentally pressed the center button and I stopped the video recording.
Okay, what if it's like a feeding one?
That's okay, I started it again.
Well, then they're generally going to be small. Yeah. Okay, so now once you get it there, have your patient put their chin to chest and start swallowing. And every time they swallow, you're going to advance 1 to 2 inches, all the way till you get to your tape. Okay, now here's what we'll throw at you on Friday. Your patient starts coughing. What do? You pull back a little bit, let them rest. If they recover, then you can proceed again. Okay. Another complication that happens is, and we haven't talked about this yet, but sometimes instead of going straight down, it starts coiling. And I've even seen it start to come out their mouth instead of going straight down. So that will be very uncomfortable. If that happens, also pull back till you can see it straight again and try again. What if they start vomiting? Suction, yeah.
Suction.
So offer them the emesis basin. You might need to suction, but do you pull it out? Heck no, because you don't want to start all over again, right?
So, but you really don't pull out unless it's like they stop breathing, or if they're like freaking out.
Well, yeah, but even if they're freaking out, once I get past the nose, I do not want to have to do that part again.
What if their nose starts bleeding?
You see the tip in the back of the throat again. But if you can avoid pulling it all the way out, because then you just have to put them through that misery again, and you don't want to have to do that.
What if their nose starts bleeding?
But if,
Do you still do it?
here's where I've seen it happen more. If they're already a little nauseated to begin with, it doesn't.
I would stop.
But that is a nose. I think
That's an
contraindication.
yeah.
Playing that gag reflex as you're pushing it.
I think ours is coiling because they got stagnated really good.
Okay, and on some of these mannequins, it won't go all the way, so just go to the point that you can push it.
Yeah, I felt kind of resistant, so I just kept pushing.
Right,
Yeah, that's pretty good though.
right. Or even till you just, they're doing okay again.
Shoved it in there.
See, it's all done now. Now we're just gonna take your X-ray.
Don't forget to tape it.
Can I do that already?
No, the one for the to the
Suppose you
cheek.
just tape it temporarily to the cheek. We'll pretend you did get it all the way to your taped point. So tape it to the cheek, and you're going to be waiting for your x-ray, but while you're waiting for your x-ray, go ahead and draw up your 30 milliliters of air and put that in, and then draw back 5 or 10. Just enough to wet your pH strip. And the pH strip, you can just leave it in your
So this one's 30.
Or if you have a little medicine cup, you can put your aspirin in there and dip it, however you want to do it.
Like there's two openings.
So it's the larger one. It's the large clear one that you always want to put your syringe in.
What's the smaller one for?
That is what attaches to the blue pigtail. It's the aluminum that lets atmospheric air back into the stomach.
Okay.
Yeah. Okay, good. So test your pH. Take a look at your, hopefully it's dark orange to red. That's that, 0 to 4
Clamping it.
range, right? And you would document, hang on
Got
to
it.
that number so you can document it later. Okay, now once the x-ray comes back and you verify placement, then go ahead and undo your tape from the cheek and tape it to the nose with your other tape.
I don't understand that.
Okay, yeah, it was a little hard to see from that, but basically what you're going for is your solid pieces on the bridge of the nose, straight up and down like that, like this. Okay, and then yeah, so these are gonna like a barber pole spiral down your tube. I get this one out of the way while I do the first side, and so they should, one tape will go one spiral one direction, and the other tape will go around the other direction, and that provides a real nice anchor. So you have to pull on it fairly hard to get it to come off.
That looks beautiful.
It is a good idea, just because if they have anything and you're near their mucosa and saliva.
To your plastic skin.
Yeah. Okay, let's see. will, yeah. And you could probably tear off, because that might get a little uncomfortable
Too
up
much?
around their eyes. So I might just shorten it a little bit.
Oh. Okay.
Okay, but good. I like your got it nice and secure. And pull on it, you can see it. It really does make it hold pretty good. Okay, good. Okay, so now we just need to hook it up to our suction. So you need your little adapter thing to put into the end, and then you can disconnect your yonker and connect this. And then it does need to get turned down because you still have your suction on high. So turn it down to under 125.
Under 125.
Yeah, so just remember clear to clear. There you go.
So that little yonker, yanker, whatever, that's strictly for the mouth.
Just for the mouth. Just for the mouth, yeah.
Okay, so it goes like in like this
Yeah, that's it.
into the big side.
That's it. Very good. And then the last thing is make sure your blue pigtail is up above the shoulder, and then you can go ahead and secure it to their gown. Yeah, to do your rubber band safety pin.
We take our gloves off.
She secured about here,
Yeah,
right?
if you wanted
Yeah.
to take your gloves off at this point, you could do that.
What did she say her friends in the up in the north call that?
Yank hour.
It's a big difference.
I know. But if you look at the spelling on the packaging, you can see how people would pronounce it different ways. It's Y-A-N-K-E-U-A, something like that. All right. And then, like how Jordan has it, that's a really good way to make it stay upright above the, just kind of drape this tubing over the back, because they're going to have to stay in semi-Fowler's position, right? So you can just leave them inclined and get them comfortable. Okay. All right. Now that you have it all put together, we're going to take it back apart. Okay. Okay. And then so then this will just
And we're all good.
everybody. Okay. So now